City County. And it's a pleasure to have you all here. Thank you for joining on time. This is going to be a webinar and a presentation on the First Health Scientific Conference for Nairobi County, which will be held between the 20th to the 22nd of November 2024. So we shall first of all have a prayer, after which I shall go ahead and talk briefly about the upcoming conference. Then I shall introduce Dr. Ermias, who is going to take us through abstract writing. And yes, so I have some of my colleagues here, but I don't think they're able to unmute themselves. So I shall go ahead and pray in Arabic. It's going to be a short prayer, simply asking for guidance before we proceed. So let's start. بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين. Thank you very much. That was a short prayer asking for guidance. I shall now go ahead and start to share my presentation on the upcoming conference. It is basically a short presentation. Okay, basically describing the upcoming conference, and I hope my screen is audible. Can anyone confirm? I mean, sorry, visible? Thank you. Thank you. I can see all the thumbs up. Great. So now let us start. Okay. Right. So, so this is a brief presentation on the Nairobi County First Health Scientific Conference, and the theme is Advancing Health Equity Towards Resilient and Sustainable People-Centered Primary Healthcare Systems for Nairobi. And as I continue with the presentation, kindly feel free to type all your questions on the chat. We have some of my colleagues from the research division who shall go ahead and answer them as we continue along. And hopefully we shall have some time for a brief question and answer session in the end. So what are the main specific objectives of this important conference? Number one is to promote health equity, tackling health disparities, and ensure health for all populations, build resilient health systems, to explore strategies for developing health systems that are proactively responsive to emerging and re-emerging challenges, including pandemics, natural disasters, and so on, to ensure sustainability in healthcare, examine sustainable practices within healthcare systems, encompassing environmental considerations, resource management, and long-term viability to ensure ongoing health service delivery. So finally, knowledge and experience sharing, sharing of research findings, best practices, and success stories, and as well as looking into innovations in healthcare systems. What are the sub-themes for this conference? We have number one, strengthening primary healthcare systems, climate change and health, global health security, non-communicable diseases and mental health. These are all, our sub-themes. We have 6 of them, so I am just going through them right now. Number 5, we have fostering innovation and use of technology in health, the role of artificial intelligence and machine learning, as well as data science in health. And finally, we have a sub-theme on health policy and governance. So now I will briefly go into the different tracks that fall under each of these sub-themes. So for sub-theme 1, which is strengthening primary healthcare systems, we have a track on integrated service delivery. We have community health systems, patient-centered approaches, supply chain management. We have quality assurance and monitoring. We have social determinants of health, maternal, newborn, and child health, maternal, newborn, child health, and nutrition. And finally, we have water, sanitation, hygiene, WASH in general. Then we have our second sub-theme, which is climate change and health. Here we have a track on climate change impacts on health outcomes, including infectious diseases. We have a track on exploring health system adaptation, resilience, and innovation in climate responsive healthcare systems. And we have the third one, which is on surveillance and early warning system, EWARS. Then For sub-theme 3, we have which covers global health security. Under this, we have One Health and antimicrobial resistance. We have public health emergency operations and pandemic preparedness. We also have health systems strengthening. We have leveraging on public-private partnerships and cross-sector collaborations during pandemics. Then we also have our sub-theme 4, which is non-communicable diseases and mental health. Under this, we have scaling up NCDs and mental health integration in primary healthcare. We have building capacities of primary healthcare workers to provide mental health services. We have gender-based violence, as well as occupational health and disability inclusion and rights protection, all coming under this sub-theme. Then we have sub-theme 5, which covers fostering innovation, use of technology in health, the role of artificial intelligence and machine learning, as well as data science in health. And for this particular sub-theme, we have different tracks, which include harnessing AI for diagnostic clinical decision, as well as drug discovery and precision medicine. We have leveraging mobile technologies to enhance community. We have use of AI and machine learning to enhance data analytics. And finally, we have a track so for this particular track, we have strengthening regulatory frameworks for quality assurance, accreditation, and patient safety standards. We have health as well. Just going to turn on the do not disturb. Then we finally have a role of community voice in enhancing primary healthcare services, community accountability to health facilities, and vice versa. So finally, what are the gains expected from this conference? We expect great contribution to the discourse on advancing health equity. We expect to gain insights into building and sustaining resilient health systems, network with influential professionals and thought leaders in the health sector, as well as showcasing, each organization's commitment to health equity and sustainability in Nairobi City County and beyond. And who are our target audiences for the conference? We have attendees who have an abstract or not. You're able to attend whether you're going to present or not. We have partners, well-wishers, and these are, we have our different, sponsorship packages, and I'm briefly going to showcase this right now, just so that, if we have partners in here who are thinking of partnering with us, kindly, you're very welcome. And then we also, our target audience also include healthcare workers, whether locally as well as globally, panelists, basically everyone is welcome. And what are the expectations? We are going to have keynote addresses. We're going to have insights from renowned experts in health equity and resilient health systems, amongst other topics. We're going to have panel discussions. These are going to be thought-provoking discussions on addressing disparities and fostering sustainability in healthcare. We're going to have research presentations, poster displays, oral presentations, and so on cutting-edge research in Nairobi and beyond. And finally, we're also going to have expos, as well as booths and workshops, practical sessions, basically to explore actionable strategies for improving health systems in Nairobi. So thank you very much. I shall now go ahead and showcase our website briefly so that we also are able to see that. Kindly bear with me. As I open the website for us. All right, so I've started screen sharing again. Okay, here is our conference website as well as conference managing platform. So I think one of the very unique things about Nairobi County that we're very proud of is we created our own abstract management platform from scratch with the help of the ICT department in Nairobi. And this is our website as well as our abstract management platform. We've put a lot of work into this over the past couple of months. We've had so many people work on this, including our scientific review subcommittee that has members not only from Nairobi, but from our partners all across Nairobi, researchers as well as people working in projects and programs across Nairobi. So we're very proud of it. And, this is what we're going to be using to not only submit abstracts, but also it has a lot more information for anybody. And this is the website URL for anyone who is interested. We shall also post it on the chat. One of my colleagues shall post it there so that you're able to access it. But I shall briefly go into the homepage. In the homepage, you're going to notice that we have all our conference sub-themes there. And if you click on any of the sub-themes, all the tracks are going to come up. We have the abstract submission guidelines there. And then we also have, a bit of information on the informational webinars that are going to be coming up. We try and have these informational webinars every 2 weeks. I believe we shall have another one with KNH UON, and we are very, grateful to UON for giving us KNH UON for giving us this platform. But this is the page where you're able to submit your abstract. We have the corresponding author name, the email. We have a bit about the abstract title, maximum 30 words, as well as the body. Basically, the guidelines are there, as well as the sub-theme and the track that you wish to submit it. Then we have our corporate packages. So this is our sponsorship packages, once again, for any of our partners, as well as professional bodies who would like to partner with us. All that information is here. Kindly feel free to reach out to us after this, and we shall go ahead and start these conversations behind the scenes. And we have more information on the contact us area as well. We have our email here. We shall also have another email there as well, so you're able to reach out to us in case you have any queries. So thank you very much. I think I shall now stop sharing, and at this point in time, for the sake of time, we shall go ahead and introduce our professor for today. Kindly give me a second as I go ahead and, yes, thank you very much. So I think I will now go ahead and introduce Professor Dr. Ermias Mergia Terefe. So Dr. Ermias is a registered consultant pharmacist with a PhD in pharmacology and expertise in e-learning, curriculum design, and health professional education. He currently serves as an assistant professor of pharmacology and therapeutics at USIU Africa, and as a co-founder of a medical education expert at Axumia Global Learning Solutions. He has published over 25 articles in peer-reviewed journals, including discovery of 5 new anti-HIV compounds named after his name, Ermiasolides. And he supervised over 10 MEC as well as PhD students and has won various local and international grants. We're very grateful to have you with us today, Dr. Ermias. Kindly take it away. Thank you very much.
Thank you. Thank you very much, Dr. Muna. Hope I'm audible enough. Can you hear me? Let me see.
Yes, we can. Thank you very much.
Yeah, it looks there is a reflection behind me, and maybe I'll put my video off. And warm greetings to everyone. Hope you are all well and energetic enough to listen to me maybe for the next 30 minutes. And can I get that assurance? Maybe if you are energetic to listen, maybe you can wave, you can maybe I don't know what you do. The emojis will work very well. It looks this webinar mode is disabled for audio. I'm so grateful to be part of this team to share the little that I know when it comes to research. And I would really like to congratulate the Nairobi County Health team, especially the research team. I know we had worked with Dr. Rebecca. I have not seen her today, but most likely she'll be there in organizing the Pharmaceutical Society of Kenya conference in June, and that was one of an excellent conference that we have ever organized, which was in collaboration with the International Society of Pharmacoepidemiology. We've done an amazing work, and that is what I also need to share today for those who aspire to submit their abstract to this conference. And thank you. I need to say thank you on that. I would have loved if my camera was so nice so that people will try to know who is this guy who is talking with that difficult name. For those who can see, my name is Ermias, is to mean Jeremiah. So if you are able to name Jeremiah, that is still fine. Before I start my long, maybe, I don't know. Okay, I don't think I'm able to share my screen. Let me try. What I will do before I go to the presentation, and I'll try to make a case so that maybe you might think if I could be the right person for you to talk to you this afternoon, so that I may not be the right person, but I'll try to share when it comes to research, what have I done on research? I'll start from that one. So I'm sure when we talk of research and when we talk of abstract preparation, for sure there should be a goal on why we need to submit an abstract for a conference. I think everyone will have a goal, and I need to persuade each one of you today. I'm sure each one of you might have had a chance to do your undergraduate thesis paper or your master's thesis paper, or some of you maybe are doing a different kinds of studies at county level, at hospital level, and you have a number of data on your table. But maybe you have not felt that could be something that can be presented in an abstract or that can be published. But through my discussion today, I need to encourage each one of you that is doable. And always research, you start it from somewhere. And with the little experience I have, and if you go to the Google Scholar page where you can see some of my works and some of my publications, maybe you can see I've done more my research focuses on experimental research, and I'm happy and proud to say that among my number of scientific discoveries are new compounds for against HIV, AIDS, which are named, these are protofolin diterpenoids. For those who have done chemistry, I think you know these diterpenoids, and this is Ermiasoli. These are 5 brand new molecules. And when we talk of abstract now, as we move on in the coming discussion, my research is not only experimental, we also do quite a number of epidemiological survey studies. This is, for example, one of the study we published with a colleague of mine on treatment outcomes and its associated factors among adult patients with solid tumor at KNH Hospital, which is more of a prospective cohort study. So in this discussion, our basic focus relies on abstract writing. And when we say abstract, we are referring to this early page that constitutes the introduction part of your research, which is a brief summary. Then the material and the methods will come as a brief summary, and I'll explain later on. Then the result and a bit of your conclusion. Finally, you pick keywords. And keywords will have a meaning and a relevance. Later on, I'll try to talk about it, because if you type on Google HIV plant extract, for sure, quickly the search engines you'll find among many researchers, for sure you'll find my name because of the number of works I have done on that area. Maybe cancer, my colleague or my name might pop up, okay? And that is the same thing where most of the journal houses, for example, this one is Taylor and Francis, one of the most reputable publisher. So when you submit your paper, it will be sent to journal reviewers. And one of the way where the journal houses or the publishers will try to find out the reviewers is through the use of the keywords. And currently I also do review for more than 20 journals, including Nature, including the American Chemical Society, and very big journals, the PLOS One and others. So allow me today, when we discuss, we'll focus on how best can we write this abstract, okay? How best can we write this abstract? So that will be the focus of our discussion. So remember, and earlier I asked you, what is the goal when you think of writing an abstract, when you think of doing a research? You might ask, really, what is the need? And usually my former professor, Prof. Demo, used to tell me, things the end in mind. What is at the end of the day, what is the end in doing a research? Maybe some of you here could be a postgraduate student. I've seen earlier some of my masters, even few of my PhD students are in attendance. Maybe you are doing it for purpose of what? For purpose of your graduation, for thesis as partial fulfillment. Or you could do a research, maybe you are in a project, maybe you are a seasoned pharmacist, a seasoned consultant doctor, and you need to communicate your finding. That's why when we talk of presenting your research in a conference, the goal is now research dissemination. So keep in mind, my word, this is a level of research dissemination. So by the time you come in to present your research in a conference, you are disseminating your research finding. So what are you going to disseminate in that one page? I've seen the requirement by the county, which is like 300 words. So ask yourself, what do you intend to communicate about your research in that 300 word? Imagine 300 word is a very short thing. So your goal could be presenting in a conference. So you communicate, you network, people will know you, the kind of research you will do. And I need to encourage you. It's not a must for you to have your PhD to do an abstract prepared presentation or writing. You have, as I told you, my goal today is just to persuade you. The same way we did in May, in April, to persuade many to submit their abstract to the PSK conference. You know, it's not a must. Most of my students in the last June conference, near to 10 of my students who have not yet graduated their BPharm have made it to just to compete. And I'll talk about what that competition is, because usually once you submit your abstract, it will go through a rigorous peer review process. And the peer review process was independent. We have sent the abstract to 3 independent reviewers. And yeah, need to 10 of the students, which I co-supervised with different colleagues, have managed to present in that conference. Not only presenting, they have got also a grant, a travel grant, and also a grant to support their registration. So I tell you, whether you present your abstract orally or through poster, the goal is disseminating your finding. In the process of disseminating, there is always a reward. It is part of your CV. It really encourages you to move and do more research, okay? And the best way to do research, the best way to do abstract, there is no rule. Even if you don't listen to me in the next 20 minutes when I share my PowerPoint, this is a home tech message. To be a good publisher, just write your research and submit to a journal house. Every time you receive a feedback, it will be polished, shaped, and it will be one of the excellent. So the earlier one, which I showed you, this one was just an abstract published. No, not abstract, it's a full paper, fully published paper, as you can see. So one of your goal of dissemination could be publishing your full research. The other one, from such a conference, you can expect a conference proceeding. I believe the organizers will have, at the end of the day, a plan to share a conference proceeding. And allow me to share this one. This is this ISPI conference, or the PSK and the International Society of Pharmacoepidemiology conference, where the organizing committee, we managed to attract 40,000 USD as a grant to facilitate this conference, to support young professionals to come and present in their research work. This is called the conference proceeding. So after the end of this conference, for sure, your finding will be published in what we call book of abstract. So this is another terminology I need you to write. Now, I'm a teacher. I love telling people to do some things. Number one, you publish in a journal. Number two, your abstract, that one paragraph could be published in a book of abstract. Let me show you on this book of abstract. Among the many which I mentioned earlier of students who published their work, allow me to search for it. It looks my PDF is freezing, but yes, here. Okay, I'm searching for my name. So all abstracts which pass the minimum criteria or threshold in terms of the number of points, and later on in my PowerPoint, I'll be able to talk about it. Hope I'm audible up to this point. Yeah, please, can I get a confirmation? Oh, wonderful. Oh, this is amazing audience. All the flowers are flourishing. Great. I just need to show you just so that I can today, if I'm successful, I'll be able to persuade a few, if not many of you, to the different abstracts. Okay, good. Look this one. Look this one. This is a young pharmacist. I think she graduated. I think she's going to graduate by this year. Look, oh, she graduated last year, 2023. Look, this one. This is now what we are talking. Her research is assessment of potential drug-drug interaction during hospital stay in patients with cardiovascular disease in Kenya. If I got the opportunity to ask each one of you, if we had a one-to-one conversation, for sure you have numerous data where you can generate to come up with such an abstract in your day-to-day working environment. That is why the act of doing research, the act of preparing a manuscript or an evidence should not be left only to students who are looking to get their degree or to researchers in the university who need to be professors. No, research should be part of our daily routine. And by the way, the first researchers, if you ever know the first individuals in history who discovered new drugs were clinicians in the clinical setup, because every day they see a problem. Every day they monitor how patients respond to some medications. So I tell you, my friends, my colleagues, it is very doable for you to come up with such a finding, and you can see later on your work being published in such a way in the book of abstracts. So if I come all this introducing the basics, now allow me to share my PowerPoint and I'll give a brief presentation. What are the key things we should do when it comes to abstract writing? Hope I have explained. Yes, I'm a pharmacist and I work at USIU, and this is a consultancy company where we provide a number of capacity building initiatives. Maybe later at the end, I'll say a word about that. So let's first try to define what is really research. I think it is very important to start with this one. You see, research is not about transportation of facts. Research is not about pulling down some key basic information from ChatGPT and putting it down on some kind of format and some. No. Research is of two things. One, research is scientific. Number one, it follows a certain scientific process. That is why we are expected to talk about how to write an abstract. We should follow a certain principle. And also at the heart of a research, we have a research question. That means we do research for mere reason of solving a research question. So remember, as a health professional, every day you observe a research problem. Go to your medical ward or surgical ward and you'll see issues which are so keen, where you might be wondering about high mortality of patients secondary to major surgery, okay? Surgical infection may be at higher rate in your facility. Maybe you are so keen on how to improve infection prevention. Imagine. Nowadays, you know that antimicrobial resistance is at another level. You see, most of the antimicrobials which been giving response are not there. Okay, so what is that research question in your mind which you need to answer by doing a research? So remember, research starts with a research problem, and you might ask, how do I know a research problem? You observe from your surrounding. You can talk to experts in the field. If you come and talk to me about the key problems in the health sector, in the health supply chain management, in clinical trial, in drug discovery, I can make a suggestion. Maybe Dr. Muna might tell you a lot of gaps in health policy, in what is happening in the health leadership, many things, you see. So that research problem can give birth to a research question. What did I say? Research. At the heart of research, we have a research problem, and it gives a research question. So in the journey you'll make to answer this research question is where you will find different methods. If you need to go to town, either you use matatu, you drive, or you take an Uber. The same way, in a way, you are interested to answer that research question. Maybe that the best way for you could be to do a basic research to generate knowledge, okay? Or maybe you could do also implementation research. Maybe in your community, there could be low immunization coverage, for example, in your sub-county, okay? This is a research question. So you try to identify what is the real problem associated with low immunization coverage, okay? What is the reason behind high under 5 mortality rate? This all gives you the basic knowledge, the factors associated with such a problem. You might wonder high rates of substance abuse among the young population. This is all a research question which you can bring in, okay? Or you could be interested in doing or in blending what has been found previously with basic and applied research and to translate it to a more of an implementation or dissemination research. That is also fine. So you can see the spectrum of research, the continuum of research could expand from discovery of a new method, a new protocol, a new treatment algorithm, to evaluating the impact. So in all this journey, what are the good characteristics of a research? And remember, when you submit your abstract, reviewers will try to evaluate your abstract in either of the following characteristics, which I'm going to mention. Imagine, as I talk this one, I need you to picture that abstract which I showed you earlier. A 1 page, that abstract is very long, a 300-word abstract, and this should be indicated even on that abstract, because remember, if you are a donor, maybe think for 1 minute. Assume you are a donor. Take for 1 minute and put yourself as someone who is going to evaluate this proposal, okay? If it is a proposal, majority of us may not have time to go through the whole length of the introduction, the whole length of your method, and finally the result and the discussion conclusion. What many people will do first, especially by using indexing like Google Scholar or PubMed, the main thing people spend time is to read your abstract. If the abstract is quite interesting, if the abstract is quite sound, is where now people will prefer to go deep and read your work. That is why I'm saying one of the important characteristics in research is that a research should be clear in the problem. And now you understand that I mentioned earlier that research starts from a certain kind of problem in solving a certain research question. That is why in the background part of your abstract, which I will also explain later on, you need really to bring out that problem. What is that problem? What is that issue you need to solve in this work? Imagine this, when you write an abstract, already you have done the research. You know, you have the result, you have done the analysis, but what is that research question? And it should also have a very clear and sound objective. It's also good to start with what is already been known. Maybe if there is an existing data, it should also be well enumerated. The other point which people miss, and we noted last time also when we review a number of these abstracts, and in many instances, yes, for example, you could talk about the ethical standard on your actual research, but still it is not bad to mention in the abstract that your research has got an ethical approval. Okay, because it is believed that all research should have an ethical approval. In this case, for example, typical example, have you submitted your research to, for example, the Kenyatta Hospital, the UON Institutional Ethics and Review Committee? Not only that, but nowadays, most research institutions like Emory, universities like KU, Maseno, USIU, most of these universities have their ethical review committee. Have you submitted it? Do you have the approval letter? And then have you got ethical permit from NACOSTI? If that is yes, pack it in one statement saying ethical approval for this research was granted from KNH ERC and NACOSTI. You know, that gives you research sound. Your research sound, because by the time you're doing your research, by the time your research passes those ethical reviews, a lot of panel beating will happen, and it gives an assurance for the reader that you've ensured the safety of your research participants, whether they are humans or experimental animals, or even if it is you do a retrospective study of medical records, then it gives a guarantee that whatever you are reporting complies with data protection issues. So in abstract writing, it's very important. Sometimes, you'll prefer to add a lot of information and a lot of scientific options, but this is what I usually advise people. Try to write it in a very generic English, as if you are communicating to a layman. That is why nowadays some journal publishers have this option. They ask you to submit an abstract, and also they ask you to write it in layman's language, in simple language. That is why in abstract, we don't encourage you to have abbreviations. Do your abbreviations on the main body of your paper, but not on the abstract. There is no need to have citation on abstract. No. Okay? Avoid too much of medical jargon, too much of complexity. It is not in abstract where you define terminologies. Avoid defining terminologies. So try to go deep into the real matter. Now, coming to structuring your abstract, this is the most commonly acceptable format of writing an abstract. And earlier, I've seen when Dr. Muna explained, this is not far from what she was explaining. You see, you need to have your research title. What was the title? And you need really to indicate all the authors that were part of that study. Okay, in this case, it was 350, which was from our previous abstract submission guideline. In this case, you are expected to have a 300 word, and it should be the abstract should be divided into these categories. You should have a paragraph for the background, okay? And imagine this background, I'll come to this one, is a summary of literally chapter 1 of your work, where you need to indicate what the work is. You need to bring out what was the problem, okay? What was the rationale, why you really did it. And then in a new paragraph is where you bring in the objective, you see. So the background and objective come one after the other. However, in the background, you pack the general aspect of the topic, why you have done it, Okay, where is the real problem? When you say problem, it is the gap. It could be a knowledge gap. Maybe you might have done a systematic analysis or meta-analysis. Okay, it's fine, but where is the gap? What is your intention to do that work? Simply, okay? Then in a separate paragraph, you indicate the objective. Maybe you can see this one. This is another very interesting abstract published in the Book of Abstract. This is from Dr. Patel. I think she graduated like 3 years ago, and we did it with Dr. Okeyo, which is a hostel pharmacist of Tika Level 5 Hospital. You can see the background, the objective in one sentence, then a clear of the methodology, okay? So remember, because of the word limit you have, you cannot be writing your abstract, your background only with 300 words. You see, your background should be concise, very concise, and the objective to the point. This study aimed to assess, these are action verbs. You can read further. What are these action verbs? Please write that. You don't say to understand, to appreciate. These are not measurable action verbs. You need to write your objective in a form of a measurable form. What is your interest? Is to assess, to evaluate, to differentiate, to compare and contrast treatment outcome of this and that, you see? Then the other aspect is not the methodology, which is the next part. And remember, in your method part, this is what we are interested to know. When I say we, the readers would love to know, how was the study conducted? Is it really valid? Okay, is it really a sound method? Is it an acceptable method? This is what we are so interested to see. So you should clearly communicate, okay, you have done a quantitative study, very good. You've done a descriptive study design. Oh, wow, good. Which type of descriptive study design? You see, descriptive study design could be many. Is it case series? Are you reporting a case report of one case of Mpox virus in your hospital? Fine, that is wonderful. And by the way, I need also to encourage many of you to write case report, and there are very heavy journals which only publish case report and is one of a sound research. Just imagine every day the kind of case you see in hospital, in health facility. If there are nurses here, pharmacists, medical doctors, many, you see, that one case of a peculiar case of a patient, that is something publishable, you see. But in your abstract, communicate, this is a descriptive study design where we've used a case report approach. Or you could say this is a cross-sectional study design, you see. Meaning you've done sampling in that case. You have not done a study on the whole population. Based on the population size, it's not a problem if your population size is very few. If you have done an assessment of few of patients in your hospital who are undergoing chemotherapy, for example, for Hodgkin's lymphoma, it's fine if there are 20, just you report about those 20 patients. It's not a must to do always sampling, but indicate what is the sampling technique. How did you select your samples? Okay, what is the sampling and sample size? It's very important to talk of the ethical statement, and I've earlier mentioned that. Remember, these steps on this slide focus for those interested in working in more of epidemiological studies. But still, if you are doing an experimental research, as I usually do, still you need to really easily communicate what is the method. Maybe you have done a research on evaluating, anti-malarial or anti-cancer activity of a certain mitishamba extract. So tell us, what is that plant? From where did you collect that plant? How did you extract it? What are the experimental animals you used and things like that? Even if you do an in silico study, nowadays the research approach has gone beyond the usual in vitro or in vivo. Now we have an in silico study. I believe most of you know that thing, where you could have done your research only by using computers, where in silico means it's a computational techniques to do research. Nowadays, most of the drug discoveries are heavily done by using a computational tools, using computers to do drug discovery. That is one of my favorite area of research. And for those, I'm sure when I talk of this thing, some of you would be very, very interested. And I would love to guide you to this publication of mine where I talked, and even I give this one to my students to look at it. This is heavy on computational drug discovery, on how to do docking, how to do dynamic simulation, kinetics prediction, and the like. But I will not spend much. But whether you do your research in wet lab, on animals, or on computer, your research method should be very, very clear. Okay. Remember, this is still on the abstract. You might ask me, how can I summarize all this detail in that one paragraph? I tell you, it's very doable. For example, look at this paper, which was submitted by most of the senior professors from the University of Nairobi. Look, this is one, and let's see the topic, antimicrobial use practice in the Kenyan healthcare facility, which was a point prevalence study, you see. You can see the method part, and you can evaluate it. It is clear it's showing us the type of study design. Hope you can see. It is a point prevalence study, you see. Where? In Mbagathi Hospital, Nairobi County. It is clear on the inclusion criteria, okay? And what are the different data that was collected? It is clear. How was the data analyzed? The software used for data analysis was also clearly depicted. So even on your abstract is very fundamental to talk on how you've done the research work. Colleagues, hope we are all together. Hope you have not left me alone, yeah? Can I get an assurance still if I have some people there? Oh, good. Oh, that these likes are going and flourishing. If you are bored of my lecture, also you can do the reverse. I know it will be very boring, but I'll finish. My problem being a teacher is the problem. Okay, we have agreed our abstract should have a background, very clear objective. Look, this one, very clear. If I am to evaluate this abstract, I can see very clear background. It was talking about the background, the basic, why the research was done. The problem is very clear. Look, the second, the third line. Antimicrobial resistance is a grave and growing public health threat today. It's trying to connect. It's trying to show us why this research should be done. Come the objectives, you see, the methodology. So, research is just like a language. Just write this one. Research is a language. So if you need to do a very nice abstract, I give you one simple rule. Check previously published or written abstract papers. Hope someone will be able to type that thing in the chat. What did I say? If you need to do a very nice publication, there's only one rule I tell students. That is, check previously published papers. Are you writing an abstract for this conference? Go and check previously done abstract papers in previous conference. You follow on how they wrote it. That is the best approach I'll ever take. Okay, after the method done, you have the result, and the result should be very brief. I've seen some mistake, just to mention. In abstract, there is no need to write the table, no need to put in your graphs. The detail comes in later on. It is not only for conference. I told you I reviewed many submitted published papers for publication for different publishers, and this is a real gap. There is no need to put detail of your result, okay? No need to talk about each and every of your result. Don't tell us in this study 20% of them have a monthly income of this much, 30% have no. Can you talk the heavy results? What is the key finding? See, key finding. Look this one, for example. You see, total of this much is a retrospective study. 185 records were sampled. Okay? Of these, like 79% received one antimicrobial. So the focus is on the real outcome of based on your research question. Maybe you could have a number of variables, but on your abstract is not really a must to talk on each and every variable. And can you try also to connect this result to your conclusion? And keep in mind, in your manuscript for publication, is a must to discuss your result, meaning you need to compare the findings of your work with previously done papers. However, in abstract, no, just you tell us about your real result. Tell us about the key result and then or the key findings, and then what can you conclude? What is the message for policymakers? Okay. Are you suggesting future further follow-up research? So let that come out in the conclusion. And keep in mind the following points. Hope I'm within the time range. Number one, this is not only for abstract. Even when you submit your manuscript for publication, follow the stipulated guideline, okay? If the stipulated guideline says 300 word, just do word counting. There are different softwares, even you can put it in a Word document and you can count. Avoid medical jargons, okay? Let it be simple and try to connect it with the conference theme. No need of citation. Maybe you might have done a very good work, but maybe there could be a lot of grammatical formatting error, and that could be the reason when the reviewers look at it and they give you a very low score. And I tell you, the last conference, we had near to 150 plus abstract submissions, so which were the first in history. So each reviewers have gone through rigorous process of review, okay? But we finally it was very few who managed to get the cutoff point to make their work to present as oral and poster presentation. So it's very important to follow the steps, to look the key best practices, to see previously submitted abstracts, submitted papers, so that you understand how best. Thank you. I can see Dr. Kevin has written that tip. Thank you. Yeah, check previously written abstracts, submitted abstracts, published papers, because research is just a language. In learning a language, you follow from the seasoned speakers. Good. So usually abstract submissions will have either an oral or a poster approach, and expect the following key common steps, be it abstract, be it your manuscript. This is a step. You submit your abstract. The editors usually check for completeness. This is very important. If not, expect to receive an email or a communication about incomplete submissions. Maybe, one of the criteria is to indicate maybe your affiliations, okay, your organization name, the details of the authors or the co-authors, okay? You miss that, it will be incomplete. Then the next part is peer reviews, okay? Because one of the things that makes a published paper sound, one of the things, why do I tell you boldly that I discovered so and so? Because it is published. It is reviewed by very senior number of professors from all over the world. You see, by the time your paper is out for publication, literally, that is what we say. It's a fact. It becomes a fact. It becomes a truth. You see? The same way your abstract will go to a number of peer reviewers. They will check. They will grade by certain criteria. And the editor will tell you then, based on the feedback, you could either get an acceptance or rejection. But I tell you, even if you got a rejection, it's fine, because there is a lot of lessons you learn from that rejection. It's a very common practice. When I tell you I published this and that, it is not as straightforward. I had received a number of rejections, but those rejections come with a comment, an input. Sometimes we go back to the laboratory to do a new protocol, a new research. So that always adds value to the ongoing research. Finally, then you need to submit your final work. So here is my key point as I wrap up my discussion. In life, if you see most countries which are successful in research, which are very successful, not on research, in growth, in economy, in politics, go and check, please. They had invested a lot on research. Check the top 3 economies in Africa, and for sure, those 3 heavy economies in Africa, and if you try to compare their investment or research, is directly proportional. So if you are a leader here, if you are maybe, I don't know, the health research Nairobi County, Dr. Muna, the best way to improve health outcome is when facilities invest heavy on research. I tell you, the kind of those discoveries had costed millions. And I'm so grateful for USIU because I was able to get a grant. And remember, when you get a grant, it is not as straightforward. You compete again. You submit your proposal and you compete, okay? So investing on research is investing on the future healthcare. That is very important. And individually, just don't sit down. As I've been a hospital pharmacist. I've been a production pharmacist in pharmaceutical industries, I've been in NGO space with Johns Hopkins University. In all those spaces, we do conduct research. So conduct a thorough research. And, research is growing. Now, an artificial intelligence has come to be part of the research process. I've told you, before I embark on my PhD, I had not heard about computer-based drug discovery, In the middle of in the initial stage of my PhD work is where I heard about computer-based drug discovery. And I said, before I finish, I need to teach myself about computer-based drug discovery, and I should know about it, you see. So the big lesson here is, and I need you to write it, is self-learning. Good researchers really self-learn. If you ask me, who taught you computer-based drug discovery? I taught myself. I sat down to study coding, to study computer-based drug discovery, to the extent now I publish. So most of my publications, of those discoveries I had, I have checked if those compounds can also work in computational models. So it's very important to update knowledge. There is heavy clinical trial, which we really need, You remember that we have all kinds of debates in the health sector, whether, you might be asked because you are doctors. People might ask you that chewing mirror causes mental health illness, How are you going to respond to that one? Are you going to check on ChatGPT whether mirror causes psychosis? You should be one step up. Mirror may not be able, ChatGPT may not be able to tell you. But you can go back and apply a different research tools and come up with a policy advice, Nowadays, data analysis has become a very heavy thing. We have new softwares, Recently, we've been training in our consultancy on clinical research methods, and we've started with SPSS. But remember, we have a number of heavy data analysis tools like R is coming nowadays. R is a new software in most of the data analysis. Which of the softwares are you conversant with, So let's think beyond this workshop. Let's make sure we build our skill in terms of research. Research is everything, Once you are in research, for sure, your attitude will change. You will not, even the way you talk should be different. You don't make conclusion, And that is the example I would love to give. If you are a researcher, when someone tells you your boyfriend is cheating, you will say, may not be. She may not, he may not cheat. Because hypothesis, you see. Maybe that could be a null hypothesis. A researcher always starts with Null hypothesis. You will not say, hey, I know him. I know her. No, you don't say that. You don't make such a conclusion. At least you refrain from making hasty generalization. So thank you. I don't know if I've taken much of the time, but I'm so grateful for you for listening. And I would love to hear any comment, any suggestions. I'm so humbled to listen. I've not seen any question. Yeah, let me just see question I can see. Yes, I know some of the questions, even some of you can help me in answering. Here, Dr. Quena is asking, allow me just to read, the difference between structured and unstructured abstract. So I think basically this is how you are writing the abstract. For example, in the earlier abstracts, which I showed earlier, the abstracts will have some kind of structure, the way introduction, objective, method and the like. But if you see the other abstract, which I had like from the American Chemical Society in one of my publications, just you are expected to write without any structure. You can put your abstract. I think that should be the difference, but maybe you can elaborate on that, Dr. I can see another one, Anonymous, is asking, how do you choose your affiliation when your study is for academic work but sponsored by the employer? Is very okay. You can have 2 affiliations or 3 affiliations and just you indicate them. I don't know how the abstract submission platform for maybe Dr. Muna can explain that later on, how that works, but it should be allowed. It should be allowed because, for example, when I was a PhD student, I had an affiliation with the University of Nairobi. At the same time, I was affiliated with USIU. So in some of my publications, you see 2 affiliations the same way. I can see Dr. Shadrach, do we need approval for abstracts utilizing from our health facility? If you are asking about ethical, let me read it for everyone to listen to the question. Do we need approval for abstracts utilizing routine collected data or retrospective data from our health facility? Shadrach, if you are asking about ethical approval, the answer is straight yes. Straight yes. Any research which you are doing needs an ethical approval. And you can go and check the Establishment Act for NACOSTI, which is the National Commission for Science, Technology, and Innovation, because I'm part of the Institutional Review Board or among the national ethical research reviewers, which are licensed by NACOSTI. And we do review a number of things. And one of the regulation in NACOSTI Act is you cannot do any research without ethical approval. And if you do that, it is an offense. And remember nowadays, when you submit even papers for publication, all journal houses, all publishers will ask for your ethical approval statement. Can one write an abstract before you conduct research? Dr. Emily is asking. The answer is no. The only thing you can do is you can write an executive summary. If you have an abstract, for abstract, you can have an executive summary, okay? Yes, so basically we write abstract for when you are done with the whole research. You have the result. You see, if you have not done the research, what can you write under the result part? You see, you have nothing. Yeah, good. And also remember, for everyone, it's also unethical to cook data. Please write it. I have not said cooking ugali, cooking egg, cooking data. Some people cook data in the office. It is also very unethical, very unethical. Dr. Claire is writing, can you write an abstract for, where is it? Can you write an abstract for a research that has not been conducted? No, the answer is no. How? That is why, yeah, if you ask ChatGPT and if you are a good friend of Chat, this AI it can give you, but that is unethical, you see? Unethical, yes. Can we get Dr. I's number? I will share the front slide. No worry, I'm always available to help, to mentor. That is what I do. Can I publish? Yes, why not? Why not? You should be planning to publish your MSc thesis. Please do it. 2021, what is the difference really? You just try to see. Is there anything that has changed from 2021? That is the question. If nothing has changed, do you need some more data? You can do maybe a fresh data collection. If not, it is very doable to publish. And I'm willing to give a little of my experience. I cannot say I have a lot, but that small thing I know I am ready to share. Kindly, can we have more session? Why not? It's very, very okay. More sessions, very okay. And so as I finish and hand over my session, and final slide before I share my contact, this is where the other thing which I'm affiliated, where I told you I'm also a consultant and the co-founder for this Axumia Global Learning Solution. We are in a team, we are doing amazing work. And recently we completed the cohort 1 of clinical research method, data analysis and publication training, which was an 11-day intensive training. So I'll put in the chat, still now we are also doing a cohort 2 of training. I was so glad last time to see most of my master's PhD students who are there in attendance. Just feel free, I will share the link. You can join. And as sales professionals, we always talk about lifelong learning. And if we agree on relevance of research, the only best way you can have a lifelong learning is through continuing professional development. I'll put the link in the chat. Here is my contact for those who will be interested to reach out. I'm so grateful. And back to you, Dr. God bless you for all those likes. Yeah, if any question, I'm still, I can be able to answer. Yes.
Thank you. Thank you so much, Dr. Ermias. I think you can just tell from all the applauses as well as the, heart messages and so on.
Yeah, it was amazing. Yeah. I'm so
We're
happy.
Yes, thank you very much. And I think Dr. Ermia's contacts are there. So this was one of those informational as well as, abstract writing sessions we had. We'll have probably 1 or 2 more with the KNHUON platform, and we're very grateful for the platform as well as the reach. And we were able to not only give insight on the upcoming conference, but I've also put on the chat our main research email. We normally collaborate with institutions in writing grant applications, as well as authorizing research in Nairobi and so on. So kindly feel free to reach out if, as well as offering support when it comes to applications and so on. We're very open to all that. But as of now, this presentation, as well as all the information shared, will be shared on our main platform link. Okay. Will be shared on our main platform, conference platform. All the information will be there. Again, we look forward to having maybe perhaps 1 or 2 more sessions before the conference. The conference, we will probably most likely, it will be held at Ole Sereni again between the 20th to the 22nd. Kindly do submit your abstracts as to whether we are going to, have, some of the abstracts not to be charged. I think that is going to be something that we will decide. Perhaps for the best abstracts, that might be the case, but we will consider definitely, having that done. I think for the sake of time, because we are a little bit short on time, I wanted us to go through perhaps the FAQs very quickly. I think the questions will be answered as they come in. Dr. Ermias, kindly do look into the chat and perhaps type in the answers for some of the questions that are, related to the presentation as we go along. I shall now go ahead and share our FAQs because we hope to answer as many questions about the upcoming conference as possible. So therefore, kindly allow us to just do this before we can bring the session to a close. Right. So this shall be handled by, one of our esteemed members from the Health Research Division, Dr. Kibera. Kindly go ahead and just do this for the division. Thank you very much.
Thank you, Dr. Muna, and thank you, Dr. Emias. I hope you can hear me.
Yes, we can. Go ahead.
Awesome. That was a very good presentation. Thank you to both you and Dr. Emias. And especially, I've seen someone commenting on the cheating. We should put research in everything. So thank you for taking us through the abstract writing and inspiring our research and the need to upskill. So I'll quickly go through the FAQs, and we keep on adding these FAQs as we get more questions, but we are very grateful for giving us this platform. So the first one is, what is the first health scientific conference? This is a landmark event organized by Nairobi City County, aimed at bringing together healthcare professionals, researchers, policymakers, and stakeholders to address critical issues surrounding health equity, resilience, and sustainability. Who should attend the conference? It's open to a wide range of participants, including and not limited to health professionals, researchers, policymakers, students, representatives from international organizations, civil society, and development practitioners and partners. What's the theme of the conference? It is advancing health equity towards resilient and sustainable people-centered primary healthcare systems for Nairobi. It will focus on how to strengthen primary healthcare systems and explore the impact of climate change, global health security, NCDs on non-communicable diseases, mental health, and the role of innovation and technology in healthcare. How can I participate in the conference? You can participate by submitting abstracts, attending sessions, engaging in panel discussions, networking, attending the exhibition, interactive forums, and also help us in disseminating this and passing this across very many different groups to gain the traction that we need. What are expected outcomes of the conference? It aims to promoting actionable strategies for improving health equity and building resilient healthcare system. Research and discussions from the conference will be documented and shared widely to guide future programs and policies in Nairobi and beyond. How do I register for the conference? Registration can be done through the official conference website. We have the link for the platform there. You can go through the different tabs from the homepage, submit abstract payment, and after payment, they'll get registration. There's sponsorship packages there as well, and some of the downloadables, which will be like this presentation and the recording. What are the delegate registration fees? You will see the different categories of the fees also on the platform. If you can kindly open and access it, you'll see the local delegates, international students, and LMICs listed there. How can I make the payments for the conference? Also in the payment tab, you'll see the different instructions through the different, I think, 3 ways of paying. That is mobile money, direct bank transfers, and credit cards. What should I do if I have more questions or need further assistance? I think also Dr. Muna has put the email within which you can send in your questions, and we have a team which will quickly get to it. I believe I've answered, I've gone through the FAQs. If there are any more questions, we'll be capturing them and adding onto our FAQs. Thank you very much.
Thank you, Dr. Kibera. As mentioned by Dr. Kibera, so I think I would like to, first of all, before we finish this session, differentiate between the 2 emails. We have the main research email, and this is whereby we work with institutions as well as partners on research, apply for grants together, as well as offer letters of support and that so on. That is the main one, which is known as the Health Research NCCJ. But when it's related to the conference, kindly share your questions as well as your comments on the main email on that platform, which is the Health Research at nccg.go.ke, as well as we have an adjunct email there. So kindly do not confuse the emails. I think that is important before we more or less bring this session to a close. Let me see if we have any more questions. Yes, we have a question on the CPD accreditation. I think that had already been answered in the beginning of the session. So we shall refer to that. Can medics from other counties submit abstracts? Of course. This is not just going to be, a scientific conference for Nairobi alone, but rather for the whole of Kenya and beyond. We shall even have presentation from some of our partners who are international. So we are working with, very many different organizations on this. So kindly go ahead and submit your abstracts, whether you're from Nairobi County or beyond. And I think unless we have any more questions, we shall try and bring this session to a close for today. We are very grateful. Once again, this was very well done, especially by Dr. Ermias. Thank you very much, Prof. We are grateful. And I think for everyone for coming for the session, we hope that you found it beneficial. Go ahead and submit your abstracts. Go ahead and look at our main conference platform. The emails where you need to reach out to us are also there. For the institutions, we've also submitted our email for collaborations, and so on. So thank you very much once again, everyone. And I think we can bring this session to a close, even though I can see there are more questions. There is a timeline for submission. So our abstract call. I think maybe we have Dr. Kibera. Dr. Kibera, when is the close? Is it the 18th of October? I believe it's the 18th of October.
Yes, it's the 18th of October.
Yes. So that is the last date by which you can submit your abstract. So kindly aim to submit before that. We already have over 40 abstracts. So we are going to, keep on collecting them and then start to review them after the 18th of October. Kindly, when will be the next session? We shall announce it on time, Faith. I think perhaps in the next 2 to 3 weeks. But we shall definitely not only talk again about the conference, but also perhaps another topic that is very relevant to the conference. So kindly just look into your email for the KNHU and webinars, and you'll be able to know when that happens. I think beyond this, I shall go ahead and perhaps we shall close with a word of prayer. And then, thank you very much, everyone, for coming. Dr. Kibera, kindly, could you please pray for us?
All right, let's believe and pray. Our Heavenly Father, we thank you for the gift of life. We thank you for this day and the chance to be able to come on here and have this wonderful webinar. We thank you for gathering all these members and having quite the discussion. And we hope going forward we'll be able to have more interaction and more webinars to be able to gain traction for this conference, leading to, and we hope to have an amazing first health scientific conference in Nairobi County. I pray this, believing and trusting in Jesus' name. Amen. Thank you, everyone, and we wish you all the well. Thank you for attending this webinar. Thank you.
Everyone, and look forward to seeing you again in the future. We shall announce the next webinar on time, and we look forward to having you all here with us again. Have a good day. Thank you very much.
Thank you. Thank you.